Dear colleagues, dear friends, today Dental Tips is dedicated to rubber dam isolation, and I'm happy to present you very interesting and practical tip how to make Brinker clamp very stable. Before I start, I would like to ask you kindly not to forget to put likes, to share this video. You will help us to spread this video for many other colleagues, and the community, dental community, will benefit from many points. Let's go. I will show you a few tricks how we can work with the tiny clamps. Like for example, Brinker 4, the tiny clamp that we usually use for veneer cementation, how to use them in some kind of deep margins and to make it stable. Because one of the problems with Brinker 4, it's not very stable. Can you give me a forceps? Yeah. So first of all, how we place the clamp. I do it myself. So it's not like assistant gives you a clamp with a forceps. You know this is a situation when there is a bar here. When you open it and hold it, and imagine there is a clamp here. So assistant gives you the clamp like that. Clamp is overstretched. This is the end of career of assistant. Immediately. Okay, so assistant gives you clamp, gives you forceps, and you do yourself. You can ask assistant to help you. Let me just show you on that side. To open rubber dam, we need to open. Yeah, this is a good view. So we need to open rubber dam to be able to see buccal and palatal gingiva, and then we place clamp. So what I will ask from assistant side, I will ask from assistant side to open a bit rubber dam from palatal side to see gum. Okay, can you just push rubber dam? More. So we can see gingiva, right? Hold it. Okay, we see gingiva from the palatal side, and I will do it from buccal side, like that. And then I open clamp just following the tooth surface. See, I do not overstretch it this way. So I place it, then remove. Okay, and then we have the clamp placed on the tooth, like that. So we do not overstretch it. I really hug the tooth with the clamp, and then this is actually prolongs the lifetime of the clamps. Now, let us simulate the common situation when you have deep preparations. And your clamp is not stable. Sometimes it comes like this. Okay? It happens. Or even worse, the preparation is pretty deep. So you place your clamp. You put your apical forces or apical pressure with the forceps and with the fingers, these two. I hug the tooth and the clamp, and I also apply some apical force with the fingers. Okay, then I remove forceps, and then I remove fingers, and clamps slowly goes up, and you just look at this. Okay, so if you see that, but this is the only clamp that is staying on the tooth. By the way, there is a much more stronger one, Brinker 5 or Brinker 6, and each one of them you can modify. You can, for example, take a forceps and bend one of the clamp's jaws. For example, from the buccal side, you can bend the clamp's jaw more apical like that, and it stays. Okay, it's more stronger. But anyways, I will show you the trick how we can make this stability here. So, for example, I place it, I press, I remove forceps. Now I will hold it, please. If I will remove my fingers, the clamp will go up. So I take flow composite, cheapest one that you can find in the market, Chinese, Indian, or maybe the one that is out of storage, date, expired, liquid dam. Because I showed this trick many times in Instagram, and some people, you know what they say, oh, so expensive, too much composite. I'm asking your dentist, so who you are? What is expensive for flow composite? Come on. Okay, so yeah, we take the flow or liquid dam or whatever, and then you just glue it to the adjacent teeth, like that. No bonding, no etching for sure, because otherwise, otherwise it will be like a jewelry, Swarovski style or something, you know. Light glue, please. And then what we have in the final, we have the position of the clamp bar distally, and we have also apical reposition of our rubber dam. Okay, it may jump also. It happens, but everything has to be dry. And look, I have a big area of the composite placed to the lateral and two canines. It actually gives me better stability of the clamp. Understand? So that's one of the tricks. So thanks for watching, thanks for being with us. Again, to remind you to put likes to this stream, to follow us, and to stay strong. Let's ready for other nice episodes dedicated to dental tips and tricks.